Good afternoon. This is Governor Bryan. I'm here at the Intergovernmental Affairs meeting in Washington, D.C. This is Lieutenant Governor Tenorio of Guam. And guess what? We're talking about healthcare and health insurance. One of the things that we talked about is self-funded health insurance. So, Lieutenant Governor Tenorio, tell us about how Guam has adopted the self-funded.
Well, we have about 10,000 Government of Guam employees, subscribers, and then another 4,000 retirees. The cost of health insurance has been escalating.
Right.
And of course, it's been a big burden on people. So, with that big pool, we decided that, the governor, my governor being a wizard in finance, we decided to take a leap of faith, and we started doing self-insurance for dental. Mm-hmm. We saw that premiums were going down, payments were going down, very good success rate. And now this year, coming year, we're going on our third year of self-insurance for healthcare. And this really has mitigated the insurance costs, but also it's really empowered us to make sure that our employees and their families are getting quality care. We're already seeing very good results with medicines, and
because you get the pharmacy rebates.
That's right. What we do is we have a third-party healthcare administrator. So the insurance provider and their reinsurance costs, right? They instead became a third-party administrator.
Right.
So when people think about, hey, what's my insurance going to be? For some people, they wouldn't know because we still have the same provider network as the health insurance companies have. It's just that we're doing the self-insurance, we're providing some great services to our people, and the insurance company, they're managing it for us. So it's a good mesh.
So it's not the government actually issuing insurance.
No. So, we basically still have the same posture. We might have a bit more compelling reason to pay closer attention, but really the business of the claims and paying the physicians and all of that, nothing changed.
Right.
In fact, the only thing that changed is that I think the physicians are feeling better because, the payments are coming on faster.
Right.
And one advantage is, with the public hospital, we don't play any games about, this is covered, this, that. The public hospital is getting paid.
So what you're saying is the public hospital benefits because the government is making sure that every claim is honored rather than playing games and saying they're not going to honor this.
That's right. No, this is late. We're not. That's right.
That's fantastic.
I think that's in the big picture. That's a very empowering thing for government.
So have in the insurance premiums that employees have to pay, have they gone up?
No. In fact, some of the savings we've done was to offset their contributions. The reality, of course, is health insurance or cost of healthcare is very high.
It is very
especially for all of us living out on the islands, right? And so many of our loved ones have to travel for specialty care. These are the challenges that we need to work out. But I think that, in order to really focus in on those, we empower ourselves to kind of take these steps.
Right.
Yeah.
We got to take those steps to make sure that we're securing health insurance. And we're going to work on a lot of other things coming down the pipe. Had a great presentation last night from a healthcare provider that could actually help us diagnose people with rare or strange diseases by comparing those symptoms to over 300 million customers, patients in the global network. So we're really looking forward to doing some great things in the territories.
Yeah, and I wanted to just thank you. Our Guam Public Health Department has a strong relationship with the folks in the USVI. A lot of people don't realize we're the most similar in government, right? Our organic tax, our elected, and I think there's so many reasons why, even though we're literally half a world apart, right? I think that there's so many good things for us to do together, and looking forward to visiting soon.
I want you to come, and I really want to thank you and Governor Guerrero for the work you're doing, your leadership, not only in healthcare, but also in energy where you're putting in all the solar as well, too. So we got a lot of things to work on. Some of you work when you're sleeping, we're working, and when we're sleeping, you're working.
That means that if we're working together, we're always up.
Absolutely. Always working together. Thank you.
Thank you.
Thank you.